Cranial sutures ossify by 18 to 24 months.
Yeah, correct. And what's the age of development of mastoid bone?
It develops by 2 years.
And what is a pterion and what's its clinical significance?
The pterion is the joining point of 4 sutures: temporal, frontal, parietal, and sphenoid. And and the middle meningeal artery runs behind it. So in case of trauma, there is a chance of developing extradural hematoma.
Yeah, and when I say 4 bones rather than 4 sutures, right? Because temporal is not really a suture. Okay. And what's its estimated location?
It is 2 centimeter behind the zygomatic bone and 1 thumb breadth behind the. I can't recall. Okay.
Yeah, one thumb behind the frontal process. Yeah, so you have here the frontal process right there. So this is 1 thumb breadth and 2 finger breadth above the zygomatic. It's not 2 centimeters, 2 finger breadth, which is slightly higher than 2 centimeter. And what's the pterion?
The middle meningeal artery runs behind the pterion, and any injury results in extradural hematoma.
Is there any other clinical significance?
Yeah, and for neurological procedures, we gain access into the cranial cavity through the pterion.
The pterional approach, yeah. And what is the source of subdural hematoma?
It is cerebral vein and bridging veins.
Yeah. And what are the muscles attached to the stellar process?
There are 3 muscles attaching to the styloid process, which is stylopharyngeus, styloglossus, and stylohyoid.
Okay. And in this image, are you able to identify the sinuses?
1 is the frontal sinus. 2 is the 2 is the sphenoid sinus. No, 2 is the ethmoidal sinus. 3 is the maxillary sinus, and 4 is the sphenoid sinus.
Yeah, well done. And in terms of the base of the skull, can you tell me what are the contents of number 3?
3 is the carotid canal, and the contents are sympathetic trunk, internal carotid artery, deep petrosal nerve, and emissory veins.
Okay. And what are the contents of 11?
11 is the foramen ovale, and the contents are otic ganglion, mandibular division of trigeminal nerve, accessory meningeal nerve, lesser petrosal nerve, and emissory vein.
Okay. That's fine. And 47, what is that?
47 is stylomastoid foramen.
Okay. So you just need to specify which side of the body are you talking about. So number 3
that is the left carotid canal.
It's actually the right carotid canal.
Oh, okay, it's the opposite. Yeah, okay, fine. It's the right carotid canal. Yeah.
Yeah, that's fine. All right. So token here, I'm gonna point to just a single structure. Can you tell me what is that? What I'm pointing to now?
That's the anterior clinoid process.
And what is this?
That is the dorsum cellae.
Yeah, I mean, this is the posterior clinoid process, right?
Okay, posterior.
And the whole thing is the dorsum cella, all right?
Okay.
And what is this foramen?
That is the foramen rotundum.
Okay, what is that one?
Sorry?
I'm pointing to another one. What is this foramen?
That's foramen spinosum.
And this is foramen ovale on both sides.
Yeah.
Good. And what is that?
That is the jugular foramen.
Yeah, correct. Again, you need to specify which side of the body.
Side. Yeah, sorry, yeah, right jugular foramen.
So actually left side.
How is that?
So you're looking from the top, right?
Okay. Okay, so when we look at from the bottom, it will be the opposite side, is it?
Correct, yeah. But I mean, you just need to think about it your own way. There is no rule really, right? All right.
Okay.
So you're looking from the top. This is anterior, that's posterior. So that's, of course, the left side. Okay. What is the related cranial nerve to the clivus? This is the clivus, of course. What is the related cranial nerve to it?
Abducens nerve.
Okay. And what is the juvenile structure forming it?
It's veno-occipital uh, osteochondrosis.
It's called synchondrosis.
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 Synchondrosis. Yeah, okay.
Yeah. And what is the type of growth plate?
It's hyaline growth plate.
Hyaline cartilage. Yeah. And what's the
Yeah.
time of fusion?
Type of fusion. I'm sorry, I'll get back to that later.
That's fine. So time of fusion, it starts by 12, 13, girls, 14, 15,
Yeah, okay, and
boys,
boys, yeah,
and
15 to
17,
6.
18. Yeah.
Okay.
And here, what are the contents of number 30?
30 is the it's the left jugular foramen, right jugular foramen.
The left or right? Why is it so difficult for
Yeah,
you?
it's from the anterior, so it's a left jugular foramen.
Yeah. What are the contents?
A jugular foramen consists of the glossopharyngeal, vagus, spinal, accessory, and the internal jugular vein.
Yeah. Fine. I think otherwise we said most of the foramina. We said 14 and 12 and 13, maybe 42.
That's a superior orbital fissure.
What are the contents of superior orbital fissure?
Nasociliary, lacrimal, and lacrimal branch of ophthalmic nerve, maxillary nerve, mandibular, oculomotor nerve, trochlear nerve, nasociliary lacrimal branches of trigeminal nerve, abducens nerve, superior and inferior ophthalmic vein. I can't recollect the third one.
No, you got everything. So basically, it's a you want to say the third, fourth, and sixth nerve, and the branches from the fifth nerve, lacrimal, nasociliary, and frontal, and the ophthalmic vein. All right.
Okay.
Okay. Can you tell me the boundaries of the middle cranial fossa?
Middle cranial fossa is bounded anteriorly by the limbus and anterolaterally by the lesser wing of the sphenoid, and posteromedially by the dorsum sellae, and posterolaterally by the great posterolaterally by the squamous superior margin of the squamous superior margin of the petrous temporal bone.
Yeah. What are the contents?
The contents, medially there is the pituitary gland, and laterally there is temporal lobe.
Yeah, cavernous sinus is there as well, including its contents and so on. Right. Okay.
Do I need to say about the floor as well when they ask about the boundaries?
Ideally, yes, but if you don't say it, it's not the end of the world. But ideally, yes, you should say that it contains the
lesser, greater wing, greater body of sphenoid, and temporal, petrous part of temporal bone.
Yeah, petrous and squamous part of the temporal bone.
Okay.
What are the benign tumors of the posterior cranial fossa?
Ependymoma and aquestic neuroma.
Yeah. You can add lots of other things as well, but it's fine. Ependymoma and the acoustic neuroma are the commonest, so you're gonna go ahead with that. Okay. Can you tell me about lytic lesions, causes of lytic lesion in the skull?
It's caused by osteolytic is mainly multiple myeloma, sarcoidosis, and
yeah, lots of them. Bone metastasis, multiple myeloma, osteomyelitis, Paget's disease, sarcoidosis, and hemangioma as well. Okay. All right. We're just going to get you that. And are you able to, in this one, to tell me what is number 7?
7 is the right common carotid artery.
Yeah, and what is number 34?
34 is the, do I need to say it right all the time or just say it's
No, just say at the beginning, just say this specimen looks to be at the right side and just say the answer after that.
Okay. It's the superior belly of Homo hyoid.
And 17?
17 is the internal jugular vein.
It's internal or external?
It is external jugular vein.
No, it's actually internal jugular vein. It's going all the way down with the carotid, so that's internal jugular vein. Okay. Fine. In terms of number 30,
Sternocleidomastoid.
13, 1, 3.
That is the great auricular nerve.
Okay. And what about 19?
That's the lesser occipital nerve.
Okay. And what about 33?
Submandibular gland.
And 31?
The sternohyoid.
And 38?
Thyrohyoid.
And 32?
Sternothyroid. Sternothyroid.
Sternothyroid. And 24?
That's the thyroid cartilage.
Well done. And 15?
Hyoid bone.
Yeah, well done. That's really good. Okay. And in this one, okay, why don't you tell me number 16?
16 is the midbrain.
Okay. And number 27?
27 would be the posterior cerebral artery.
Okay.
I mean,
And
is it posterior?
you're right. You're right to say the posterior cerebral artery, but which side of the body?
Sorry?
Which side of the body is it?
It's the right.
Yeah. Okay. What is 23?
It's the optic chiasm.
And 24?
That's the optic nerve.
Left optic nerve, right?
Yeah,
What
okay,
is
left
this?
optic nerve.
What is this? I'm
That
pointing
is
to
the left
something.
internal carotid artery.
Well done. And what is 19?
19 is the left oculomotor nerve.
Correct. And what is 40?
40 would be the,
Which is here as well.
yeah, that would be the trochlear nerve.
The only posterior branch, right? It's coming from the
Yeah.
posterior surface. Correct. All right. Well done. Okay. Just skimming through really, because we need to move into what's the difference between an upper motor neuron and lower motor neuron facial nerve palsy?
If there's an upper motor neuron palsy, the contralateral lower half of the face is affected, and in case of lower motor neuron palsy, the ipsilateral half of the face is affected.
Okay. And in terms of neck vessels, I'm going to show you a few things down there, and you're able to identify to me these structures of this, okay?
Okay.
Starting by A.
A is the right vertebral artery.
The right or left?
It's left.
Yeah, so the scan, this is a scan. So you
Yeah,
really
sure.
need to work on what's right and what's left, because this is extremely
Yeah.
important exam, all right?
Yeah, okay.
So in a scan, it's the other way around. Well, and basically, if you're doing a cadaver, so basically considering, looking in your body, in your own body, and you're trying to find out. But on a scan, it's the other way around. Okay. So A is vertebral artery. What about B?
B is the right vertebral artery.
And what about D?
D is the basilar artery.
And E?
E is the posterior communicating artery.
No.
That's a posterior cerebral artery.
No. What about F?
That is the posterior communicating artery.
No. So F is the posterior cerebral artery. So you have here D is the basilar going all the way up. The two terminal branches of basilar are the posterior cerebral arteries.
Cerebral artery.
And
Okay.
just below it, there is a superior cerebellar artery. Okay.
Okay.
I always call that, you know, a man holding a cigarette. And I'll show you what I mean now. Let me just get the bigger.
Oculomotor.
Correct, yeah. Oculomotor in between. I think it's very clear on this one. So you have vertebral coming together to basilar, and number 3 is, do you know what is number 3?
That's the anterior inferior side.
Yeah, the ICA or anterior inferior cerebellar artery, and then you go up and you have 27 as the posterior cerebral, and then you have 35 as superior cerebellar, and 16 is the oculomotor nerve, and 12 is?
12 is the internal carotid.
And 15?
Middle cerebral.
And 2?
Anterior cerebral.
And 20?
20 is the optic chiasm.
And 21?
Optic nerve.
And 22?
Optic tract.
Well done. And 39?
39 is the pituitary fossa.
Yeah, pituitary stalk, right?
Pituitary stalk.
Yeah. Well done. So let's apply this to these images, if that's okay. All right. So here you want to say F is posterior cerebral artery, and E is superior cerebellar artery, right? Okay. And K is
middle cerebral artery.
And J is
anterior cerebral artery.
And H is
internal carotid artery.
Yeah, and of course all of this on the left side. Okay.
Okay.
Yeah. Well done.
So where is the anterior posterior communicating artery with the?
You tell me. Try to find out what is the posterior communicating here.
So that will be G.
No, G is still the ICA, but you have a very tiny branch down there.
Okay.
Yeah, that's the posterior communicating, because it connects between the ICA and the PCA.
Yeah.
So that would be the posterior communicating. All right. Can you identify here maybe number 3, which is right there?
3 is the posterior communicating artery.
Correct, yeah, on the right side. And then 2?
Yeah. 2 will be the basilar artery.
No, not really. No.
Yeah, it will be the posterior cerebral artery.
Yeah, and 1 is?
That will be the basilar artery.
Okay, and 4 is?
4 will be the anterior cerebral artery.
And 6 is?
Middle cerebral artery.
5 is the anterior communicating.
Artery.
Yeah. Yeah, well done. And what is the abnormality here?
Where? Which one?
What's the abnormality in this image?
I can't see the image.
What do you mean you can see it? You just saw the previous image. I don't know what's the difference now.
Is there an image? I can't see. It's blank. Okay.
Are you talking? Can you see this one?
It's not staying stable. It's going up and down.
It's probably your internet connection. It's working okay from my side.
Hello? Yeah, now right.
Yeah, so you wanna get this habit of saying the abnormality.
Right, yeah, that side, yeah.
Okay, that's fine. Let's get you